The urology department at the Dunedin Hospital held a megaclinic over the weekend to address the waiting list problems identified at length on Checkpoint during July, August and September. It was a catch-up exercise supported by urologists and specialist nursing staff from throughout New Zealand who travelled to Dunedin to assist Southern DHB staff address concerns about waiting times and care provided in the urology department at the city's hospital. 561 urology patients were seen over a busy and reportedly successful weekend, from first-time specialist appointments to more serious procedures, including 45 patients having biopsies. I asked Dr. Nigel Miller, the DHB's Chief Medical Officer, how many of those biopsies have returned positive results for cancer.
Well, we won't have those results yet. I can't give you a figure, obviously, because I don't know, but you'd expect around about 40%.
OK, so roughly 20 of the 45.
If that turns out to be true, yes.
Should they, and I know we've had this discussion many times and we do appreciate you fronting again, should they need to be seen in a mega clinic?
Well, ideally, no, absolutely not. We should have had this all sorted out. And this is our, wrapping up all the things that have been outstanding. So some of those patients are more recent referrals since this process started. So it hasn't all been people who've been dragged out. But you're quite right, there have been delays that are unacceptable.
If we go back to the external review in June 2017, so June of this year, and probably the most famous of the key observations, there is a significant level of clinical risk within the long-waiting patients at the Dunedin site. Were some of the people who had surgery over the weekend for prostate cancer those who had suffered the effects of that significant level of clinical risk?
I can't give you the details of each case. Some will have been delayed beyond what was desirable, absolutely.
Do you now know how many people have been delayed beyond what was desirable?
I can't give you a definite figure yet. We've been focusing, as you would reasonably expect, on getting the work done to get it effectively caught up to where we should have been. And then once we've done that, we can work out precisely what the figures are.
OK, let's talk about the process of catching up to where you should have been. How far through that process are you now? How many more mega clinics required?
Just one. It won't be as mega as last weekend. It'll be a smaller catch-up on swallowing up some of the things that may have come up in this clinic, and a few other patients that couldn't make it to this clinic, wasn't convenient, and so on. So we've done the majority of it, but there's a smaller number left to do with a smaller number of clinicians. I haven't got the precise numbers for that.
And that's the second weekend in December?
I believe so, yes.
And then at that stage, you will be where you would like to be. In other words, you will have caught up.
That's our expectation, yes.
What sort of state were the patients in? Were they relieved, happy? How were they at the mega clinic over the weekend?
Well, the impression I met most of the urologists who came down from around the country, and I must admit, we very much appreciate their commitment. It was really a huge effort for them to give up their weekends to do this. And the feedback I had from them, that most of the patients were very pleased to be seen. And some of them said they found the process simple and straightforward, and it worked very well for them. So I didn't hear of many negative comments. People were just pleased that we're getting on with the job.
Are you going to get the resources you need to ensure this never happens again?
I think it's a mixture of things. Definitely there's a need to review the resources and the way they're applied. For example, the staffing levels. We've done some of that already. We've engaged extra nurses, and we're looking at what to do about extra specialist time. As well as that, it's reorganizing the way we do things, and we've demonstrated that. Well, we've had the assistance and help from a lot of people to come up with a different way of running clinics and being more organized, which is what we run over the weekend, and that'll provide us a model for the future. So it's a mixture of, people don't like the word efficiency in health because it kind of implies you're not working hard, but sometimes people end up working really hard because it's inefficient. So getting things lined up so the care of people referred into the urology service is streamlined and things run smoothly through, rather than them involving extra time for clinicians at many steps. We can plan things ahead.
Dr. Nigel Miller, who's the Chief Medical Officer at the Southern DHB.